Pill phone is actually exhibiting here at the show, available on all three of those major carriers here. Helps people manage their medications. You keep a list of all of your drugs. You can do drug-to-drug interactions. You can set up reminders so that it reminds you to take a drug, and then you can confirm you've taken it. And if you want to, you can share that information with the caregiver. So that can be helpful for kids or elderly folks. So very interesting set of dynamics. You can download it on a number of cell phones today. So, and I believe I think all three carriers have it priced approximately the same. I think it's in the neighborhood of about $3.99 a month. So that's an interesting overview of how wireless technologies and cell phones will kind of begin to impact folks' lives. You see a nice overview of commercial and soon-to-be commercial products. And you'll hopefully understand why what I do is working to put every body on the net. One question.
Accepting some of these products, like when you say things like you have to go to the doctor, I find that the time when I don't think I have to, but I'm looking at medication card and they're going to be called, I'll be better than that. So how is medical professionals accepting some of this stuff related to mitigate their interaction with patients?
Yeah, so how's the medical profession accepting some of these solutions? And the answer is mixed. And it's mixed for a variety of reasons. Sometimes it's unfamiliar with the technology, and sometimes it's frankly the threat of a business model. Sometimes the answer is to why you're being told to come into the office is that's the only way they're going to get paid for the interaction. There is no reimbursement mechanism for a virtual interaction in many cases. So sometimes our systems of payment and accounting don't really take into account what people would actually prefer to do or what they could do. But where they exist, payments exist, CardioNet's been in the market now for 5.5 years, reimbursement's well accepted across more than 300 health insurers. It's very well accepted by cardiologists. Video conferencing, vis-a-vis MICA, which is a relatively new company, but MICA has received over 1,600 requests from primary care physicians to become physicians using the MICA platform to virtually interact with their patients. Now, MICA has actually launched a business model in New York called Hello Health. It's a particular primary care practice. You can look it up on the internet. It's particularly directed at young urban dwelling professionals in New York City, typically Mac users. The business model is basically come on in, meet your doctor, choose a doctor, meet your doctor, and don't come back unless you have to, because they will interact with you and manage as much as they can virtually on the system. And in that particular business model, they've set up a membership model to make the economics work right. So the patients pay $35 a month to have access to a practice that will interact with them virtually. Interestingly, that practice also supplies all the generic medications you can eat for free as part of your $35 a month visit price. So kind of interesting twist in kind of a subscription membership, convenience, and primary care. That's just one business model or a way of using that platform to deliver some primary care. Thank you very much.